Hi, I'm Dr. Victoria Sampson, and I'm a general dentist. I think that what I love the most is actually having an impact on patients. All we want to do is improve our patients' quality of life, and if there is a new thing that a dentist can adopt to improve that, it's a no-brainer. Dentures still have a very big role in general dentistry, and patients need to feel confident about them. We were all taught that denture adhesive was a temporary fix for a poorly fitted denture, and we never saw it as anything else. And only when I was actually in practice and I tried it with patients did I realize that it can provide a lot more. Recommending a denture adhesive from day one is not because you haven't done a good job. It's because you want to make that shift for a patient from never having a denture to living with a denture as seamless and easy as possible. The adhesive acts as not only something to stick the denture in, but also it's quite viscoelastic, and it helps with balancing those pressures so that the denture fits really nicely and there's not a specific area which is receiving more pressure than another area. And that will reduce the risk of gum irritation or ulceration. Also, the adhesive will seal out those empty spaces and stop food from getting trapped under the denture. The biggest change for a patient when they start using an adhesive at the beginning is their confidence. They feel a lot better smiling, eating, talking, particularly those patients where maybe I have improved their quality of life. When they do come in, they're so grateful and so thankful. It is the reason that I wake up in the morning to make those types of impacts on patients. I would recommend to all of my colleagues to be open to change. It doesn't matter how confident you are with your denture. It matters how confident the patient is with their denture. If just making a small shift in your own habits can improve that patient's journey, then it's worth it.